My name is David Nichol. I'm the incoming chair of the Testicular Guidelines panel from July of this year. I think there was a broad range of changes across the guidelines in revising the text and also updating many of the references. There was a large number of really historical references providing evidence, but they've been refreshed, which has reinforced the value of the guidelines and that they remain relevant even though they are related to guidelines that were written many years ago. I think of the various recommendations, an important new one relates to vascular thrombosis and embolization, which occurs in patients with testicular cancer. Groups that are susceptible to those with large retroperitoneal masses, and also specifically patients who require cisplatin-based chemotherapy. This is perhaps an overlooked area of clinical practice, but it's an important point to highlight that urologists need to think of those that may potentially be at risk and consider prophylactic measures to prevent complications arising as a consequence of treatment or the disease. I think there are two areas that we're trying to address at the moment that will be a focus over the next few years. Firstly, the issue of centralisation of testicular cancer care to specialist centres, given that it's a very rare disease yet involves quite complex oncology and also surgical treatments. The other area is changing technologies and whether or not minimally invasive surgery is going to have a role for patients undergoing retroperitoneal resections for residual masses following chemotherapy or as an initial therapeutic measure in patients with low volume stage 2 non-seminomatous germ cell tumours.